We're now live.
Good morning.
Good morning, everyone. So I'm Dale Gardner. I'm here from NHSBT for a very exciting webinar series that the Commonwealth Tribute to Life project is kicking off. Our goal is to run a series of webinars every 2 months with different regions who are part of the Commonwealth project, sharing where they are up to, and we're going to continue them over the next sort of 12 months and see how we go. We're on, actually, for those who are joining, we are actually on a Zoom meeting, not a Zoom webinar. So please mute yourself and potentially turn your cameras off for this stage. What we're going to be doing is we're soon going to introduce our guest speaker. And then what will happen is once we've had that presentation, we'll move on to a panel discussion. And the whole, our aim is this will be an hour session. I'll ask my co-host to please help admit people as they keep joining up, because that'll just make it easier. But without further ado, as we begin this sort of webinar series, this one hosted by NHS Blood and Transplant from the UK, I'm going to ask Professor Gertsch Randhauer, who is a Professor of Diversity and Public Health at the University of Bedfordshire, to please come and introduce our guest speaker, who I know you are very involved with in the work. So over to you, Gertsch. Thank you very much.
Thank you very much, Dale, for that kind introduction. So to start off, let me firstly thank Professor Sunil Shroff. So when the Commonwealth Tribute to Life initiative began with Dr. Satya Sharma, we were keen to develop evidence base across the Commonwealth countries. And I spoke to Professor Shroff and said there is an opportunity to access some global challenges research funds to look at global problems, and organ donation and transplantation really is a global problem that we all want to address. And he kindly put out a call across Mohan Foundation and across India. And we had the extreme pleasure of interviewing and assessing Britza. He probably didn't find it pleasurable at the time, but he's gone on an amazing journey comparing different states in India. I'm delighted that on that journey his work has been published, recognized with awards, but most importantly, after today, what we wanted to do is translate that research into impact, and that's really where we want this conversation to go from today. So look forward to hearing your talk, Britza.
Feel Britza will.
Sure. Yeah, I'm getting the screen shared. I hope everyone could see the screen.
We can see it if you just launch it from the start.
Okay.
It'll be perfect.
Could you let me know when it
has
gone up? Okay.
If you just go to the slide, we just can see the presenter, the slides, like with all the slides. So if you just push slideshow start.
It's already on slideshow. Let me stop.
Yeah, that's good.
Yeah,
no.
that's fine.
Try
okay.
it.
No, can't see.
No, try again, Britza.
Can't see your slides now.
Okay, let me share again. It's showing slideshow for me.
Oh, it's coming. So all we can do is see we can see like the master, the individual thumbnails on the left. How many monitors are you running, Britza?
One.
Okay.
Can you see now? It's sharing for me.
We can just see the thumbnails, but if you go down to the advanced one.
Okay, advanced.
It is advanced the slide. It's come off again. Sorry, everyone.
Sorry. Yeah. I go to the Windows and I'm sharing as usual, like how I share. Now?
It's a say, can you advance one slide? What happens if you go forward one slide?
Now?
Yeah, we can read them okay. All we can see at the moment, what we can see is the thumbnails as well as your slides. But that's okay. We can manage, and you can feel free to begin.
Okay. Yeah, sorry for the delay. I've been doing this the same way like before. It didn't come up, sorry. So good morning, good afternoon, and good evening, everyone who's attending from different time zones. And I'm Britsa. I'll be presenting my PhD research, which was on barriers and facilitators toward deceased organ donation among Indian population, which includes both the general public and the stakeholders. Firstly, I would like to thank the collaboration between the University of Bedfordshire and Mohan Foundation, without which the work would have come to pass, and also the Global Challenge Research Fund, which funded my PhD. And also I'm grateful for Commonwealth Tribute to Life, who has given me this opportunity to present the PhD findings. To give a bit of background about the country where I did my research, which is India, it is a country which is comparable to a continent, which has in various aspects, such as its geography, language, the food that we eat, or the culture, the history, and economy or the healthcare system that each state functions with. And talking particularly with respect to transplant services across the regions in India, about 80% of transplants are from living donation compared to 20% of transplant from deceased organ donation. And again, when we further look into the deceased organ donation practices, they are highly varied across the different regions in India. There are several studies which have been undertaken to understand the barriers toward deceased organ donation and also the knowledge and attitude. However, there is a gap in research in presenting all of these studies together and show what the overall findings suggest. And as we all know, India is the first largely populated country, which accounts for almost 18% of the world population. And also it is a population with the highest migration across the world, making this population more of an international focus as well. Therefore, many studies have been conducted among Indians living beyond the borders. And therefore, we undertook a systematic review which tried to understand the barriers toward deceased organ donation among Indians, not only living in India, but globally. We adopted an integrative systematic review approach using narrative synthesis, which gave us the freedom to include both quantitative and qualitative studies. And a total of 89 studies were included from 4 different countries. Both the protocol and the outcome paper has been published in BMG Open for further reference. Now, what did the systematic review say? The 89 studies, the findings were classified based on thematic analysis using narrative synthesis on 6 topics, themes such as knowledge, attitude, family, religion, bodily matters, and fear and mistrust. Now, all the studies have shown that everyone have heard of organ donation and they know what organ donation is. And the knowledge was higher among the younger population, people from higher socioeconomic status, and people who had educational background, especially from healthcare or even healthcare occupation. However, the knowledge was good and people knew about organ donation. The studies also showed that they were not clear about what brain death was and that it's really considered as death. And also, they did not know where and how to register majority of the participants in these studies. Talking about the attitude, knowledge had a positive correlation with the attitude towards deceased organ donation. However, knowledge was not the only component that influenced their decision making toward deceased organ donation. There were various other constructs such as family, religion, bodily matters, fear, and mistrust that influenced their way of thinking or the behavior towards deceased organ donation. Talking about family, most of the studies have shown that the participant has opted family as a major barrier towards organ donation. However, majority of the population have not had conversation regarding organ donation with their family members. And when we looked at the studies within India and outside India, the second and third generation who are living outside India, such as in UK, Canada, and Malaysia, all of these places, they were more open to talk about organ donation compared to the first generation, which could have been the reason that they grew in a different social environment that their parents or their family, the first generation, came from. And with regard to religion, majority in many of the studies opted religion to be a least barrier. However, all these studies also showed that they are unsure about what their religious standpoint was, and which could have an impact on their views toward deceased organ donation or registration and consent. And talking about the bodily matters, they had concerns about, can I do the funeral services as usual after deceased organ donation? And they felt that what they do with their body after death is their own rights, and it is their decision and not other people's right to make a decision. Talking about the trust, the majority of the concepts that were covered with regard to trust was around organ trafficking and premature declaration of death. And these concepts were influencing their trust in the healthcare system. So what gap did we find in the systematic reviews? Majority of the studies which were conducted in India followed a similar approach and a similar aim, producing repetition of studies, and there was lack of diversified research among this community. It was more about knowledge and attitude, and also in a very particular or a same kind of research approach they have used, which led to lack of further in-depth understanding about certain concepts. And also studies outside India often grouped Indians with a larger, broader population, South Asian population, and consider them as a homogeneous population, whereas in reality, they are not. Though they are all called South Asians, they are very diverse in the social environment that they grew, which had an impact on their health behaviors. And also, there is a gap in qualitative research among the public. Yes, qualitative research are being conducted, but not in a depth like comparing between the cases, between various strata, which the further studies that we did. And also, there is a lack of research among the transplant coordinators' experience being published. Now, while it is essential to understand what the international practices are to achieve self-sufficiency, it is equally important to understand why certain centers within the same country perform well compared to the other centers and to take lessons from them. And therefore, there is a great need to understand it from the subjectivist perspective of the general public from various levels of society, and also the experience of transplant coordinators working in different centers within the same country. And hence, we undertook a qualitative research among the public and the transplant coordinators in the south and north of India. Now, when I say south and north of India, there may be a kind of a doubt arising that, as you see in this figure of Indian map, which is a study published by Dr. Vivek et al. In Transplant International in 2021, the dark green shows a place where they have initiated and expanded the system for practicing deceased organ donation, with the light green where they just initiated and the orange one is not initiated. And the white ones are initiated but not expanded their services. Now, a line of argument is that, okay, send the regions which have good infrastructures perform well, which is obvious, and regions which do not perform well because they do not have the environment where they could function well. However, the line of argument for my research for the upcoming two studies that I'll be explaining is not based on the number of hospital centers they have and all of that, but it is majorly on the note that within the existing system, what is happening? Within the existing system in the north and south of India, what is happening? I'm not comparing the regions based on the number of hospitals or the facilities they have, but within what they have. So my sampling strategy was this purposive stratified sampling, where I took the samples from North India and South India. When I talk North India, the region is in particular are Chandigarh and Delhi region, and in South it is Chennai from the state of Tamil Nadu. And the next level of strata was based on the type of study population, which is the general public and transplant coordinators. Among the general public, we further classified the study population into three levels of strata, which is based on religion, gender, and age group. What did the study among the public say? Individuals from their own perspective are willing to be organ donors and they have a more positive perspective towards deceased organ donation. But it is not only influenced by their individual views, but the decisions are influenced by their family, religion, community, and healthcare. This is in alignment with the findings from the systematic review. Now, what's happening around all these constructs in a society where an individual lives? Talking about family, this population is more of a collective decision making rather than what an individual thinks is right for him or herself. Now, the individual's agency to choose is most often overridden by the collective decision making. And in a country where the policy is more of a soft system, be it a soft opt out or a soft opt in, it ends up with the family's decision. And if they have higher power in overriding an individual's decision, it plays a kind of an important role. Now, in in such kind of society, the conversation is very important for for the individual to share his own willingness to become an organ donor or not. Now, what happens around why systematic review said the conversation do not happen, but why does it not happen? Now, when we looked into this communication pattern of the families within this community, it is more of a conformity oriented versus conversation oriented. Now, what do I mean by that? Conversation oriented is a communication pattern where the views of both the parties, the party who's speaking and the party who's listening, receiving end, are having the same alignment of views. Whereas conformity oriented is one person and the other person who's listening, or the other way around, both have different views. And in the communication pattern within the Indian community, they are conversation oriented in various aspects of life, such as what do they want to study or what various aspects of their daily living. However, research showed that when they shift the conversation towards sensitive topics, they change their pattern to conformity oriented. Now, that is being a struggle within the community because the individuals who are willing to talk about organ donation perceive that their family is not supportive of organ donation, or they do not think this is a normal conversation. And the perceived resistance that they have within their community stops them from having conversation. And therefore, it is important to normalize the concept of organ donation. However, what they felt is it is very hard for me to talk about my own death. However, the participant, again, from the younger population, irrespective of the religion or the region they come from, they said that it is, on the other side, easy for us to converse on organ donation with our family members and the community if we see something in the community. However, these participants also said that that visibility is not much in the community, which challenges their communication. Yes, they also said there is more visibility among the famous characters coming and the famous personalities coming and sharing about organ donation. But what the community needed from their subjective view is we need real donors to come and talk more than the celebrities or the famous characters. Yes, it reaches, but it connects on an emotional level when we hear the real life stories. And also, they wanted the donor family and the recipient family to be someone who they could relate with, not always the family and the recipient from from a higher socioeconomic status, but also people whom they could relate to, and having concepts talking about the moral or the emotion behind the donation, or why they came forward to donate, or the pain of people who are waiting for organs for transplant. Talking about the religious aspect, when they talked about religion, they said that they are unsure of what their religion tells. However, we took Hindu, Muslims, and Christian population for the study group. However, no offense against any kind of religion, but the point that came out of the focus group discussion is that Muslim population is more oriented and more dependent on what their religious views are. However, from their individual perspective, they are willing to donate. The unsure view of their religious leader or their religious standpoint is something that is stopping them from moving ahead. And therefore, as we talked about the visibility, having more donors and recipients from those particular, from diverse religious population and religious leaders talking more widely about organ donation will improve. And in the community, when they talked about community, when we asked about, do you hear about organ donation in the community? And yes, they said that it is very less often spoken. But where they heard is from the social media. The systematic review showed that majority of the information they receive is from social media. Now, what does social media say is very important, because the organ donation rate in India is less than 1 per million population. Now, what does that mean? That means that only less than 1 per million have real experience with the organ donation concepts and the experience. And where does the majority depend on there for the information? They depend on the media. Now, when we further probed on the focus group discussion, they said that yes, media talks about organ donation. We saw it in many movies, but how are they portrayed? They are portrayed more from a negative aspect to increase the thrill of the viewers to sit at the edge of the seat to watch the movie, what's going to happen next. And that carries a negative impact among the community because they perceive what is shown in the media to be reality, the majority. And that is really creating a misinformation and trust issues within the community on this concept, sensitive concept. Now, talking about the healthcare practices, trust was really an important issue that came from the systematic review, but it was more from an organ trafficking or premature declaration of death. But when we probe further, what influenced trust? The concept that came were diverse. The study population said that yes, we donate organs free of cost, but organ donation among the public, organ transplant, on the other hand, was viewed as a commercial concept. It was viewed only as a concept which is available for the rich and the affordable. So the question that they rose in the focus group discussion, many groups were, if we donate out of free of cost, we can't afford a transplant because the transplant happens in private hospitals. Now, it does not mean that transplant always happen in private hospitals. Transplants also do happen in public hospitals. But the problem that we found in the focus group, they have never seen a government hospital publicizing organ donation or leading organ transplantation, which tells them that yes, it is accessible even to individuals who cannot afford a high cost transplant from private hospital centers. And and therefore there is a need to improve the visibility of public hospitals doing transplant and showing the high quality of services that they deliver with regard to the transplant. Therefore, it improves the trust. Yes, if I need it one day, I would be receiving it. So yes, I am happy to donate. And also the mistrust happens because of the general practice that happens when they consider the difference between government and private hospitals. Yes, government is they give services, but they are not of good quality, whereas in private they are in good quality, but they are not affordable. So these kind of general practices around the system is also influencing their views or perspective towards organ donation. Now, what the findings from the transplant coordinators were about what were their experience in an efficient deceased donation process? What are their struggles? What are their facilitators in making a deceased organ donation process more efficient? The first thing that we came across was creating accountability. Now, how did the transplant coordinator said that creating accountability was seen in mostly in private hospitals and in some very few government hospitals, that every role player is being designated a specific duty that they should perform. And everyone has an expectation in their mind that they would be expected to report one day on the what's happening for every cases. And role of awareness of what each individuals involved in the process of deceased organ donation does is important to build the rapport between the team and the coordination between the team. And how this was done, in the interviews, we found that private hospitals mostly have frequent meetings where they talk about what happened, case by case discussions, where they talk of different stakeholders come and share their experience, where transplant coordinators share their views, the neurologist or the intensivist shares their view, or the hospital management team come and give a push on how much importance priority they give for these work. This in improve their rapport and cooperation and network within the team and beyond within the hospitals. And the other issue was around the delay that the process caused. It was because of the heavy workload. In public hospitals, doctors have a heavy workload already on them, and they often feel that it is an extra duty for them to do with nothing coming back in return for them. And also that when they uh, have to do diagnosis of brain death, they have to leave their patients and come and do this extra duty. So it was like an extra work that they have to do with the usual work that they have, and that has led to delays in the process, and which negatively impacted the process of deceased organ donation. Now, the delays in some other aspect also happen from a medical legal point of view, where majority of the cases are brain death from road traffic accidents where it involves police investigations. Now, there were certain regions and certain centers where they and Mohan Foundation as well as indulged more with the police officers in improving the awareness and the role that they play in the process of deceased organ donation, and they had many strategies and policies put in place to stop the delay. So they created more accountability and their understanding of their role in this crucial process, and also several strategies to shorten the time. Now, as we spoke and as we found in the systematic review about deceased organ donation, the concept of brain death being poorly understood among the public, that also had a impact on the doctors who were doing the diagnosis. Transplant coordinators, from their experience, said that sometimes doctors are a little bit hesitant to do the diagnosis because they feel that, oh, there could be controversies among the public. It would damage the reputation of the name of the hospital or the name of the doctor. There were several cases of which misunderstanding led to negative impact on the reputation of the hospital or the doctor or the trust. So that had a negative impact in diagnosis of the brain death and the concept of it itself. And also, we did interview few doctors, but we were not able to include in the analysis purpose. And what they said was about the definition of brain death only accepted as death in the process of organ donation, but not in the real concept of death. So that again built a lot of confusions and controversies among the doctors' views towards brain death being legally called as death. With the process of brain death, explaining the process of brain death were done in two ways. One is orally explaining them and through showing the scan reports, and other was to take them to the ICU and show them how the patient is looking. But the transplant coordinators also said that when you take the patient to the ICU, it is important that you first prepare them very well about the concept of brain death so that they don't misunderstand any nerve reflexes or the warm body and relate that to existence of life. And there have been studies which have showed that demonstrating could improve the understanding of brain death. Now, communication with the family is very important among the transplant coordinators, which came across all the 14 interviews. They said that only inform the factual information, do not give them false hope, and preparing for all potential outcomes, and being there around the family all the time. All that they need was frequent updates from the transplant coordinator, what is happening on a time to time basis, and giving them frequent update, and always being there around their vicinity to show that they are available to answer any of the questions that they have, and not to rush to any decision or not to judge before going and approaching a family on what would their decision be. And this actually positively helped the discussion and the counseling process. Now, about the active identification, active role of transplant coordinators, centers which had coordinators right from the right from the emergency room, understanding what cases are being admitted in the emergency room every day, going for rounds, understanding the case history, where they come from, and also looking through the family members who are there around them. How is the decision being made? Identifying the decision maker, identifying the family dynamics of who is more supportive, who is more aggressive in any kind of conversation that is being taking place, and identifying the stage of grief. And all these were possible only in centers where the transplant coordinators were supported and they had an enabling environment. And this really helped them to take a gradual approach throughout the process that positively improved the efficient deceased organ donation process. Now, as Pallavi has also quoted in one of her presentation with this webinar about the private spaces, private hospitals have good private spaces available for all these discussion, where they could take the family, identify the decision makers, and appropriately take the families to the counseling room, which is a quieter environment where where they could understand, where they could calm themselves and be able to answer any of the questions that they have in a quieter place. And places which did not have private space were negatively impacting the decision, such as people coming in middle of the discussion and disturbing their approach, or they would have prepared the family slowly and someone comes in middle of the conversation and negatively impacts. And because of the noise and the environment they are around, the poor concentration among the family members. And studies have again showed that having sensitive conversation in quieter place improves their ability to understand and accept. Now, what are the recommendations for practice? Yes, there is a need to standardize and mandate practice. Mohan Foundation has been giving good training for transplant coordinators across India to be efficient transplant coordinators. However, while the law has mandated the presence of transplant coordinators in all organ donation center, it is important to mandate an enabling environment as well. Whatever the lessons that we have learned from the well-performing centers, it is important to mandate those practices within the centers which are going to initiate organ donation, as again quoted by Dr. Vivek Kute et al. In 2021 Transplant International Journal. And there is a need to improve the strength and availability of the quality of data. All the centers need the need to present the data to the government or to the central agency where it is available to the stakeholders to look into the performances or to look into the practices and learn from what makes a center perform well within the country and implementing those in their centers. And there is a need to even more increase the visibility. Yes, Mohan Foundation has been working very well with the famous character personalities and also with the donor families and recipient, donor recognition. But there is a need to improvise it even more, which is possible through working collaboratively with the governments, with the hospitals, and taking a whole system approach. And again, when we talk about donor families, more representation from diverse communities, from different religious groups, from different socioeconomic status. And again, improving it, including this in the curriculum of schools, where they could take this concept and discuss with the family members. Again, not just talking about their own death, but someone's story they could bring to the family, which will help in initiating the conversation. And also, as a study published by Dale and Gertsch about the whole system approach, where it is not just important to work with the stakeholders, but also with the public. Again, as Professor Schroff has presented in one of his presentations, it is as how much of importance we give to the public to improve their awareness. It is equally important to improve the cooperation and understanding and the support from the stakeholders as well. So it is equally important to work with the public and also with the stakeholders. With regard to the research recommendations, it is important to diversify the research further now. More in-depth research to understand whether certain interventions work. Yes, Mohan Foundation and many other organizations worked with the road traffic department, with transport department, to include organ donation question in the license. But does that how efficient, how effective is that? Or should we do some other extra additions into those strategies to improve even more connection with the public, to improve the donor pool? There are many research conducted in the UK where they have used several messaging strategy researches, even with the transport, with the driving license, whether should we include an image or just a logo or just asking them, or a nudging message strategy. So using more diversified organ donation research is important to inform the practices. And studying the Indian diaspora as a distinct group and not as a homogeneous group with the neighboring countries is very important when studies are carried out beyond the borders. When they study of Indian population, it is important to specify their findings and discussion individually based on the country or the society they come from, and also to involve a lot of stakeholders apart from the public, the whole team, the neurologists, the intensivists, the policymakers into research as well, and many interventional studies to understand whether an intervention works, and if it works, whether is it feasible in order to carry out those strategies. At the conclusion, I would like to say from the research, it is evident that it is not the public to be blamed at all for the increase, for the less number of donors, but there is a need to work with the stakeholders as well, equally as we work with the public. And that we hope the research findings are being taken into in informing the policies and strategies. And these are the references that are used. Thank you.
Thank you very much, Britza.
Thank you.
That was a huge amount of work that you did. Fantastic. What I might do is I'm going to introduce the panel, and then we can reflect on what you shared with us, and then we can go forward. So first of all, Dr. Sunil Shroff, the Managing Trustee of the Mohan Foundation, Lalitha Raghuram, who's the Country Director for the Mohan Foundation, Kirat Modi, who's the Honorary President of the National Kidney Federation, and Gertrude Auer, who you'd met already. But what I'll ask is I'll ask the panelists to just reflect, and then we'll open up for questions and discussion, and Britza, you to share that. But my first reflection, as I just get us going, is that sort of huge graph and chart you built of the donor transplant coordinators and their reflection on the process. I've often said that this is the most complicated system, donation and transplantation, that any health system does in any 24-hour process. And I particularly liked how you built that chart up to show that complexity. So it makes me depressed and maybe wonder why anyone ever says yes, or why we ever get a donation to go ahead, because it's so complicated. Any sort of reflections? I'll go to the rest of the panel members, but maybe get Gertch and just to talk first about that concept of the PhD and what lessons you took from Britza's research, and they'll move around the panel.
Sure. So firstly, thank you, Britza, for the findings. So let me start off with that slide. So I think it's really important that when we're thinking in any country to build a transplant and organ donation infrastructure, it's not really an either or. We kind of need to, in parallel, build a healthcare system that enables staff capacity and capability. And I think that slide very eloquently shows the range of complexity that's involved just in that transplant coordinator role. And that's only one part of it. We haven't even got into organ retrieval, tissue type matching, or all of organ matching, etc. So that's only one part of it. And then also, I think the other important thing that comes out of Britza's PhD is about how do we build confidence and trust with the donation and transplant system. And you kind of need to do both. So people want to be reassured that they can be potentially beneficiaries of a transplant, and also they want to be reassured that people who are from their background are actually engaging in the donation process. And I think sometimes we forget that people don't have the confidence in governments in many countries. So I'm not singling out any country at all. But if I give an example for those of you who are familiar with the UK politics recently, we had race-related riots in the summer. That didn't really help build confidence for many communities. It actually put them in quite a nervous and disadvantaged position. And we need to make sure that those communities feel that donation and transplantation is something that they can be fully engaged with.
Thanks, Gertch. Might go to Lalitha, and then Sunil's not here. I can see then to Kirat, and then we'll come back to Britza. Lalitha?
Yes, congratulations, Britza. Very well presented, very comprehensive study. I know it's a lot of hard work traveling the length and breadth of India, so congratulations on that.
Thank you.
Most of the findings that you have found, I mean, that's something that resonates with what we feel at the Mohan Foundation, what we have found through the years of work. The one thing that I wanted to, in fact, two things that I wanted to ask you is, um, as you can see in India, the south and west of the country are fairly progressed with deceased organ donation, whereas the north and the east is still taking time. Do you have any observations there? Why there has been more progress in the south and the west, and that's one question that I had. And the second thing is, did you also have a chance to compare the eye donation with organ donation progress? Did you take a peek at the eye banks in the country? Um, because what I have found, since I have a background in iBanking, I keep looking at the progress that has happened in iBanking versus organ donation. If you take the progress of iBanks in India and put the organ donation map, it is pretty much the same in India. Wherever we have progressed with iBanking, organ donation also has taken roots and has fairly advanced. So just wanted to check if you had a chance to look at the iBanks also. So these two questions.
Sure. Yeah. Thank you so much for your support as well with the study. Yeah.
Always.
Now, to answer the first question, why is the difference? Yes, West and South are performing well compared to the other regions. Now, what came through the literature and reading through all the other studies was that the amount of collaboration, as we all know, it's complex. It's not just hospitals who are involved in this. It is the road traffic uh, department. It is the government department. It's the healthcare sector. It is the hospitals itself. And so we see from these regions that they are more collaboratively working, and everyone understands the importance of it,
Yeah.
because like the police department understand the importance of it. They know what role they really play in. And I think the need for what we could learn and take home for the other regions is, when we build an organ donation system, right from the beginning, build with the collaboration. Right from the beginning, involve everyone. The decisions are not just supposed to be made by NGOs, or not just by the hospitals, or not just by the government. The decisions need to take into account of everyone's view, so that they feel, oh yes, we are involved. Oh yes, we are considered important in this. So they have that accountability and the understanding of their role and importance, which I see in the South and the West happening a lot. And yes, obviously, we can see the public health status of different states apart from organ donation as well. We have differences. We could say that it is by generic, or by the way the system works. But if we can show that we can make difference in the system, in a complex system like organ donation, that would be a lesson for other public health issues around the country. So as the South and West have been collaboratively working, I think it is important to involve them right from the beginning, even donor families and the recipients, in all the meetings and the work that is being undertaken, so they know the importance of it. Uh, the other thing is about the eye donation. In this study, yes, we looked generally as organ donation, but what we felt was eye donation, they did cover while we were having this focus group. And it was easier for them to, in most of the cases, it was easier for them to say, oh, yes, I am happy to go with eye, but not with the organs. That kind of concept did come universally across all the focus group discussions. But we do not particularly look into eye donation in specific, which could be something that we could look further enough for the future in research. Yes.
That's always amazing to us, Britza, because in the UK, we have a much more lower consent rate for eye donation, and it's always fascinating that in India you actually lead with eye donation, and it's much more positive. Whereas for us, it's much more negative, very cultural specific. I'll go to Kirit then before we open up questions for everyone.
Thank you, Dale. And can I say congratulations on your presentation? Really interesting information there. I'm speaking from a UK perspective. I'm also a kidney transplant recipient. I think the issue about trust in the health service is a major issue in the UK as well. And I think particularly after COVID, those issues have been highlighted, and there are lots of evidence about the reduction in the support for organ donation in the UK following COVID. And one of the things we've done in the UK, which I know Gertch and others, we've been working together for many years, is how you reduce that lack of trust by involving the community and the community leaders, particularly the religious community and the religious community leaders in the UK, by enabling them and empowering them to take a leadership role in actually doing this. And we've had this program for a number of years now, where NHSBT funds community groups to actually take the lead, go out to the community, and they are the people who are giving the messages, sharing the stories of organ donors and recipients and so on. And I was just wondering whether in the work you've done, whether that approach, where particularly in India, lots of religious communities, whether any of them are taking a lead in promoting organ donation in India.
Thank you, Kirit, for the question. So, talking about the trust, there are various section elements that you asked in the question. The first one is, I would like to say, in the research that we did, was that organ donation, organ donation, you donate organ free of cost, but the transplant happens in a private hospital. That's what the people's perception are, because they feel transplant to be a private concept, because that's what they see around. It's not their fault, but that's what they see around all these private hospitals doing transplant. They're saying, oh, we completed 100 transplants, we completed 500 transplants. But what they don't see is the public hospitals. Yes, public hospitals do transplant. They do good transplants as well, and they have high quality transplants. But it is the visibility. We need to increase the visibility that it is happening in public hospitals as well. It's not a system like in the UK, where it is majorly NHS. It's a mix of both public and private in India, and which has its own complex issues around it. Now, there is a need to improve the visibility of donor families and recipient families who have received transplant from government hospitals. Yes, they are doing in India. Mohan Foundation is doing a lot of recognition events where they go to the governor's house or with the chief minister, giving them awards. But again, there is one of the reasons for the South to perform well could be that, because they are doing it in the news channels during the prime time and everything. But there is such kind of visibility need among the public in other regions as well, to show that yes, it is accessible to anyone. So they know that even if I donate, one day when I need it, I will get it. It's not that I can't afford a transplant. And this goes on with the community engagement that you have been telling, where the donor families take a lead, where the recipient families take the information forward and they be the leaders. Yes, we still do have those things happening in India, where we still have people like that background working within Mohan Foundation. Even Lalita, who spoke now, is having personal experience with organ donation. Now, we have people there, but again, there is more support. The thing in NHSBT is it is being funded by NHSBT. But if such kind of collaboration between the government fund, the public fund, and the organization, we have a lot of organization working. So if we have that kind of collaboration, that definitely there are people who could take this work forward ahead. And there are religious leaders who are taking a lead. And sure, in many interviews, there are things happening. Yeah.
Thank you.
Fantastic. Thank you. Let's open it up to anyone in the audience. Please feel free to put your hand up or put it in the chat. Any comments? while while I'm waiting for anyone to come forward, Britta and the panel in general, we had a guest from Spain come across, and they suggested to us that in Spain the health system isn't really well liked by the public in Spain, but donation and transplantation, especially donation, really is. And they really separate the messages. They don't, when they talk about donation, they never really talk about it as being part of the usual health system. So whereas in the UK we have NHS Blood and Transplant, they sort of would really focus in on donation and their organisation as separate. Almost in Australia, I know they have Donate Life, and so they have a different branding and for that. So just as before we go to Baroness Finlay, any thoughts on that from Kirit and then the panel, and then I'll go to Baroness Finlay. Or Gertz, do you want to make a comment?
Sure, thank you. I guess one of the things that Spain are very good at is in their media and society in general, they do have a lot of visibility for donors and donor stories. So that can be living donors, deceased donors. So consciously, subconsciously, the Spanish population know that donation happens. And to an extent, what's interesting is they give very little visibility to recipient stories. So they really amplify the act of donation. And that may also be something to consider.
Very interesting. Baroness Finlay, our patron of the Commonwealth Tribute to Life project, thank you for joining.
Well, thank you so much. That was really interesting, and the conversation too has been very interesting. On the slide, you had the fact of the community and how people behave, and I just wonder, you see the threat of social media, misinformation, and so on affecting this, and it actually Gertsch's comments about Spain really feed into this, because I'm aware that there's a very different cultural approach in Spain to in the UK. We can't just straight adopt it, but I do wonder what you see as the trend because of social media, because I really worry it's working against us, basically.
Go for it, Britta.
So yes, social media really has an impact, as you stated, on the way the information is being conveyed on organ donation to the public. And as Gertz said, improving the visibility to counterattack the misinformation is important. As Spain followed concentrating more on the donors, I feel like from the study that we undertook in context of India, we can't just follow fully what Spain has taken, like showing only the donors, because that is what the concern was with the public in the Indian context. They are like, do we get transplant when we need? Because when they think that it is a rich person's concept getting a transplant, they often, all this organ trafficking, everything will be amplified with such kind of a mindset. The transplant is for rich, but when we take the transplant is for everyone, I think that would help us to handle that. Yes, I got a transplant, but it was not I did not give any money, so it was not like in a negative way I got the organ somewhere from. So yes, in an Indian context, improving the trans recipient story is also equally important with donor, but recipients should be from the public health service area, not from the private alone. Yeah.
Very good answer. Yasser Martini, do you want to just also tell us what country you're calling in from?
Sure, I'm in London. Team Margot is a campaigner for more donation of all sorts. And I just wanted to follow on from your point, Dale, and also what Gertz said about the act of donation. The NHS Blood and Transplant is probably not that well named, given that it has a sort of public-facing identity, because it feels very medical. And nothing happens without a donor. And it almost needs a rebrand on that front. But it is about donation. And really, I just wanted to echo the points that were being made earlier. It's about switching, and Gertz has long championed this idea, and we have all been bashing on about this switch that's needed, a cultural shift to bring donors more into the spotlight, in the UK at least.
Indeed, and here. And for those who don't know from around the Commonwealth, we've just celebrated Organ Donation Week last week in the UK, and that week used to be called Transplant Week. And there's a distinct work by Sir Gertz and others to really sort of move that discussion. And so that's we're proudly Organ Donation Week last week, and plenty of buildings were lit up in our pink colouring, which we used to for ourselves to promote donation. And I think that's part of that journey. So thank you, Asa, for that, and Team Margot. Is there any other sort of comments anyone would make in the final few minutes? Britza, what next? What are you going to do next? You finished your PhD. This could be about your own personal life. You might be, or which country you're going to live in, or just where do you want to take this in your career? What are your thoughts when we finish on you for bringing us done? And don't go away, everyone, because I'd like to get a photo at the end. So just before you drop off in the last minute or two, but final words from you, Britza.
Sure. So following the completion of my PhD, I wanted to work with the community to improve to work with the donor family and the recipients, and because of which we wrote an funding application for NHSBT, through which we got it in the last year, and now we have got it for the next two years, where we would be working with the government, with the council authority, the local council, and we are also working with the art organization, where we are going to take it in a form of art, an art not formed by the artist, but co-creating with the public. That's what I wanted to do. Whatever we do ahead, co-create with the donors, co-create with the recipient and the public, rather than coming from only medical or the artist alone. And also moving forward, I am looking at seeing whether the things proposed by the public is really going to work in India, like the strategies, whatever they told, like working on with that and seeing and work on with messaging strategy, whether there is any kind of messaging strategy that would work among this public to nudge them to get involved or connected with the concept to make an informed decision. So it's more like seeing whether things proposed from the research will work and whether it is going to be feasible.
Fantastic. Well, congratulations on your PhD. Just as we close, we'll be doing another webinar in 2 months' time. But if people are willing, if they could just put their camera on, because we make a lovely screenshot of us from all around the Commonwealth. If anyone, if you're able to put your camera on, we'll just take a screenshot of you all. Don't get shy and all drop off at the last second. I'll give you 5, 4, 3, 2, 1. Give a wave if you want. Well, thank you, everyone, and especially thank you to Britza and our panelists today. And the Commonwealth Tribute to Life project is going to strength as we try to sort of share knowledge and expertise around the Commonwealth. But that's it for me. Have a great rest of your evening, morning, and everything else. Thanks very much, everyone.
Bye.
Bye-bye.
Bye-bye.